I've seen this kind of speculation in the press and the media, and I don't think there's any reason to hide the data. I don't think it's being airbrushed. I just think it's being confused.
Dr. Hilary, hello.
Hello, Dan. How are you?
Well, I'm okay. So we're now totally social distanced, it should be explained. I'm back in the newsroom here in central London, and you are where, Hills?
I am at home in Kent.
But it's lucky, Dr. Hilary, because when we were filming 2 weeks ago, I probably had COVID-19 in my system, given that I got the symptoms a few days later and I didn't pass it on.
Yeah, thankfully, that's the benefit of physical distancing. If we all keep 2 meters apart and we go out only for essential roles, then hopefully most of us will be protected against contracting the virus. That's what social distancing is all about. And hopefully, in our case, it's worked for me. Both our producer and myself so far, touch wood, have been okay. And I'm glad you're better now and out of the woods.
Yeah, no, exactly. I mean, I was very, very conscious to always do the social distancing. The moment that I experienced symptoms as well, I literally locked the door to my flat. I didn't step foot outside my front door for 7 days. But what is interesting, Hilary, I've spoken about the fact that there is this corona denial phase. And I was definitely in it, I think, for the first 48 hours. We've seen Boris Johnson was definitely in it because, to begin with, Dr. Hilary, it's actually very hard to know if the symptoms you're experiencing are anxiety or just feeling a bit run down, or whether they actually are COVID-19.
It's very difficult because not everybody gets the typical diagnostic symptoms of a dry, new, persistent cough and a high temperature. Some people have no symptoms at all. Some people have a sore throat or a runny nose. Very few people have red eyes. And it's very variable. Some people start with chest pain and breathlessness. So it's easily confused with other things. And of course, we don't have enough testing. We're just asking most people to self-isolate and only contact 111 or their GP or 999 if they experience really severe breathing difficulties. So people don't know for sure whether they've had it or not.
Yeah, the fatigue was a big one for me, and the fatigue came thick and fast very, very early. But I guess the moment I really realised, Hills, was when I lost entirely my sense of smell, virtually all, I'd say 95% of my sense of taste. And in a way, I was relieved because it was that moment when I could say, okay, I've definitely got this now. And in a way, that felt quite good, given that we can't do testing over here.
Absolutely. I mean, that is a symptom that people are commonly reporting. Loss of sense of taste and smell seems to be quite a common symptom. It's currently not in the guidance as a reason to self-isolate, but if you've got other things as well, it makes sense to stay at home and not take the risk.
Yeah, I mean, from my experience, from people who I've spoken to, it's the one symptom that is like a surefire sign. But look, Hilary, we've had so many questions pouring in since our last episode on Thursday, so let's get straight to it. Jeffrey Blair says, what is the timescale of COVID-19? When does the fever ease? And is that the start of you getting better?
Yes, for some people, the temperature is one of the first signs of COVID-19. Some people will experience the temperature for a day. Some people have had the temperature, like Boris Johnson, for 10 days or more continuously. Some people will get a temperature which comes and goes. So it's very unpredictable. Some people say that they've got the temperature, it goes, they feel a bit better, then it comes back. So I think just being alert for a temperature which is unexplained, isn't caused by the usual cold symptoms such as sore throat, runny nose. You know, temperature is a sign, and that is a good reason to self-isolate.
Our next question is from Rebecca Dobson. Thank you, Rebecca. And she asks, are there any drugs that are helping to treat patients with coronavirus? Because there's a lot of rumours, there's a lot of conjecture, but is there any proof, Dr. Hilary?
Absolutely, Dan. Look, there's a lot of speculation. There's people saying, oh, try this, try that. What evidence do we have? There's some evidence that antioxidants like vitamin C and vitamin D can help with preventing oxidation of iron released from red blood cells. There's speculation that vitamin D can help boost the immune system. But there are three particular lines of inquiry, if you like, in terms of medication that we're currently conducting trials on based on experience from around the world. We're doing these trials now on COVID-19 patients in the UK, and we're looking at three things. First of all, antiretroviral medication that we've used for HIV in the past. We're looking at dexamethasone, which is a powerful steroid that we use as an anti-inflammatory. And thirdly, we're looking at hydroxychloroquine, which has been used for a long time and is a cheap drug for the use in treatment of malaria.
It's the one that Donald Trump loves, Hills.
Correct. Yeah, he's talking about it. Look, we need to do the trials. We need to work out whether this is beneficial, whether it does prevent what they hope is the replication of the virus in human cells, in lining the respiratory tract. Now, if it does do that, if it does protect against the replication of the virus, it could mitigate the severity of the condition in some people. It's probably not very helpful when people get to the critical stage. It's too late then. But we need more evidence as to whether this works and whether we give it to everybody. At the moment, we're looking at that and comparing it to these other medicines as well.
Question 4 is on video today. Say hello to Lynn Parkin.
My name is Lynn. I work in the community as a carer. I'd like to ask your opinion as to why we are continually not getting accurate data regarding the deaths of coronavirus. The most vulnerable group was said to be the elderly or people with underlying health conditions, which many live in the community, and lots of elderly people live in care homes, hundreds of thousands. Why is this data, why do you think this data is continually being hidden from us?
Do you know what? I think I've seen this kind of speculation in the press and the media, and I don't think there's any reason to hide the data. I don't think it's being airbrushed. I just think it's being confused. In fact, it would be in the government's interest to highlight that the number of fatalities are higher, because it would make people sit up and take notice about social distancing and staying at home and the importance of lockdown. So I don't think anyone's hiding data. Let me explain how it works. So we get statistics from hospitals. That's easy to do. That's based on what we see from hospitals. It's reported very quickly. There's always a time lag after weekends and things, because there are less staff to record the data and report it. But hospital mortality is easier to report. Then there are deaths in the community. Now, in the community, in care homes and at home, if somebody dies, usually a doctor will give a death certificate based on what they know about the patient. So if the patient's death is caused by pneumonia, that would be the cause of death, pneumonia. But a contributory factor might be COVID-19. But it would still be recorded as a death that's related to COVID-19. But those statistics, the ones that occur in care homes and at people's own residences, are sent to the Office of National Statistics. Now, it's a bureaucratic process. It involves the coroner. It involves various bureaucratic organisations, if you like, that are in place to make sure that when people die, there's no shenanigans, there's no suspicion. It has to be recorded accurately, and that takes time. So there's a time lag between getting the statistics from the ONS and from hospitals, but we'll collate it together later. We'll find that there are more deaths from COVID-19 that we're currently seeing reported from hospitals, and we expect that, but there's no need to hide it.
No, but there's a lot, I guess, about the full picture of this, which we'll only learn probably over weeks and months and even years. The next question from John Houston. At what point will the world know that this virus is completely gone, including all infections?
Well, what will happen, as we've seen with other pandemics, is that the virus will spread through different countries of the world, which it has already, and it'll continue to become more prevalent in the general population. Most people will recover, and we hope that most of those people will have an immunity, which we hope will be long-lasting. There will be some people who the virus just passes by from random chance. 20%, 30%, hopefully 40% will never be exposed to the virus and never get symptoms and never be ill with it, and never be carriers. They're just randomly lucky that they won't be exposed to it. So down the line, when we come out of lockdown in a phased way, there'll be some people who are immune, some people who aren't immune. We won't know who they are because we don't yet have enough antibody tests. But the herd immunity that we refer to in the general population will be higher. So the chances of it being passed on as time goes on becomes less and less. Hopefully, by the time we get to a year from now, we'll have an effective, safe vaccine that everybody can have, and then everybody will be immune. But until then, there will be random cases, hopefully on a diminishing level, that will enable the health services in different countries to cope.
Exactly. So, John, unfortunately, the idea that this virus is going to be completely gone is probably a fantasy, really, just like we live with the winter flu today. Great question here, Hilary, from Dawn Hazel, who needs some practical help. She says, I'm due to start volunteering in a care home soon. What precautions should I be taking?
Well, it's really important for you as somebody going into a care home to make sure that you haven't got any symptoms, and clearly don't go if you do have, or any doubts at all. When you go there, you need to be very careful about practicing hand hygiene, washing your hands frequently with soap and hot water, using hand sanitizer, and preferably, if there is PPE available, wearing the necessary protective personal equipment that will protect both you and the residents in the care home. But by golly, they do need all hands to the pump. They need as much help as they can get. And care workers everywhere, whether they're working on a domiciliary basis or in care homes, they're doing a most remarkable job. Some of them actually staying in the care homes so that they're not travelling back and forwards and transmitting more virus potentially, giving up their family life whilst they're looking after their residents at this difficult time. And I salute you all. I think you're doing a marvellous job. We know that you're not well paid, and hopefully in the future, when people come out of this, they'll realise what a fantastic job you're doing, and they will salute you, and you'll get better pay. I think that's one of the legacies perhaps that this pandemic will create. But thank you. Anyone who volunteers, we need you right now.
Well, that would be an amazing legacy if that was the case. Dawn, thank you for your question, and do go ahead with it. Alan Mason, very important issue, Dr. Hilary. He says, I am a bus driver. Would wearing a mask help to protect me from catching coronavirus? What about gloves? And of course, we know in London, Dr. Hilary, the Mayor Sadiq Khan has come under intense pressure over the lack of PPE for bus drivers.
Yeah, it's a major problem for so many people who are in public-facing jobs, checkout staff, delivery drivers, bus drivers, train drivers. They're all potentially exposed to the virus from the passengers and the people that they come across on a daily basis. Now, in an ideal world, they would all have the necessary personal protective equipment. There's this controversy about masks, but let me just say, I'm not talking about the general public here. I'm talking about those public-facing roles, such as bus drivers. Their cabs should be cleaned thoroughly on a daily basis, at least on a daily basis. They should be wearing masks to protect them from other people that they come across. And of course, they're protecting those people too from the bus driver themselves in case they're an asymptomatic carrier. They should have a shield, preferably, between them and their passengers. And I know that steps have been taken to have the middle doors opening to let people on and the back doors opening to let people off, so that they're kept away as much as possible from the driver. But we've had too much loss of life in public transport staff, and they do need to be protected. And the more PPE we can get to them, the better.
Absolutely. On a similar practical note, Carrie Chan says, can one use gloves and face masks many times without changing to new ones?
It's a very good question. Depends on the quality of the mask. Once a mask, if it's a paper mask or a cloth mask, once it becomes moist, it can actually harbour the virus. So it's important to use a mask correctly. If it's a good quality mask, it's worth looking after. when I say looking after it correctly, wash your hands before you put it on, wash your hands before you take it off, and then wash your hands again after you've taken it off. That prevents cross-contamination of the mask, and then allow it to dry so that it dries thoroughly, which enables the virus to decay. Some masks can be reworn that way. High quality masks obviously are much better than others. If it's a poor quality mask or it's just a scarf around your face, the holes in it can easily be penetrated by the virus. So that's worth bearing in mind. As regards gloves, once you've touched something with your glove, then potentially your gloves are contaminated too. Can you wash them? You probably can with soap and water in the same way that you wash your hands, but detergent can interact sometimes with latex and other materials that the gloves are made up of. So you have to be careful. You probably wouldn't want to do that too many times. But if you've got no other gloves, by all means wash them. Just be careful of any deterioration in the material.
What absolutely brilliant questions today. It has been a pleasure to be back. Thank you, Dr. Hilary. And of course, if you want to ask anything of Britain's most trusted medic, he is here every day on the Sun's YouTube channel and also on my Talk Radio Drive Time show between 4 and 7. So you can ask a question right now by heading to thesun.co.uk/Dr. Hilary, or by going to talkradio.co.uk, or actually if you want to ask a video question, and we love those, just use the hashtag Ask Dr. Hilary on Twitter or Facebook or Instagram or wherever you want to post. Dr. Hilary, we'll chat again tomorrow.
Glad you're back, Dan.